Just 32 years ago, a much larger epidemic hit Shanghai. Many of the older generations will have a vivid memory. At that time, Shanghai had a resident population of only 12.5 million. In just 2 months, nearly 300,000 people were infected with the virus, but Shanghai defeated the virus in just over 2 months. January 16 and 17 of 1988, similar to the period of this year's new pneumonia outbreak, Shanghai Huangpu District Infectious Disease Hospital and Huangpu District Central Hospital successively treated more than 20 patients with vomiting and diarrhea. Most of them were accompanied by symptoms such as fever, vomiting, anorexia, fatigue, and yellowing. Immediately afterward, the number of people with similar symptoms climbed rapidly, much faster than expected. 43 cases on January 18th, 134 cases on the 19th, 808 cases on the 22nd, 1,447 cases on 23rd, 5,467 cases on 27th, and 12,399 cases on 31st. At the beginning of the epidemic, Shanghainese felt a considerable amount of tension and panic, as rumors of an unknown plague outbreak, a biochemical crisis, the apocalyptic theory, and so on were spreading. Everyone felt like they were in danger, and the bustling crowd disappeared, and the streets became quiet and deserted. Like this year's new disease, the epidemic 32 years ago was also due to the foods we ate. A clinical survey organized by the Health Bureau showed that more than 80% of the confirmed patients had eaten our clams before the onset of the disease. Medical researchers also quickly confirmed that our clams were culprits of the hepatitis A virus based on the evidence. At that time, our clams were seafood that the Shanghainese loved because it was cheap and delicious. Shanghainese in 1988 were fashionable and exquisite, and they were very particular when it came to eating. People in Shanghai knew how to eat the clams. They boiled it and dig out the tender and delicious meat when it opened up. However, this method did not kill the virus. The average incubation period of hepatitis A virus was about 30 days. The virus is excreted in the feces, and it pollutes hands, food, or water and enters the body through mouth, transmitting the disease to others. At that time, the public health sanitation in Shanghai was inadequate. The narrow old-fashioned lanes in the old city and the dormitories owned by the state-owned enterprises were crowded with men, women, and children, and there were no public toilets in many buildings. The long incubation period, poor sanitation, and frequent contact led to the virus spreading unknowingly, with an epidemic affecting nearly 300,000 people. How did Shanghai defeat the epidemic in just 2 months? The first step was the public health education. At that time, there was no internet, and the latest epidemic situation was published in newspaper, local TV station, and radio stations. The second step was to identify and curb the source of the infection quickly. The Shanghai government banned the sale of our clams, and anyone selling were punished harshly. The third step was to mobilize the people of the city to participate in the battle. At that time, Shanghai has only 2,800 beds for infected patients, and total hospital beds in the city was only 55,000, which were entirely used up in less than a month. Factory enterprises took the initiative to convert warehouses, auditoriums, and guest houses into temporary isolation wards to allow the hepatitis A patients to move in. During this period, 12,541 isolation points stand, 100,018 beds were set up in Shanghai, and another 29,000 home beds were added. At that time, there was 100,000 medical personnel in the city, and about 60,000 were fighting on the front line. Nurses worked 3 shifts for more than 10 hours a day. It was heartening that although ordinary people felt afraid and nervous at that time, they still trusted the government unconditionally. Since March, the number of new cases in Shanghai was decreasing every day, and by the 21st, they had been completely controlled. In the 2 months from January 19, the city's hepatitis A epidemic saw a total of 200,092 cases and only 11 people died. The epidemic laid a solid foundation for Shanghai to establish a complete public health system, including prevention, warning, and response to outbreak. The major hospitals expanded the sizes of their wards and have established departments for infectious disease. In 2018, 16 hospitals in Shanghai were included in the top 100 list of Chinese hospitals, and 3 hospitals from Shanghai even made it to the top 10. As an ordinary people, we only need to trust the Shanghai government and do our part. It is everyone's duty, from reporting, quarantine, and isolation, to prevent the spread of the disease.